73. Danny Mortimer is Chief Executive of the NHS Confederation. Welcome, how are you?
I'm well, thank you, Eddie. How are you?
I'm fine. How are you at the end of this year?
We're very well. We're a membership organisation. We represent NHS organisations in all sorts of settings in England and Wales and Northern Ireland. And I'm very aware of, frankly, how tired our members are. As you rightly highlighted, teams across the NHS, hospitals, community services, primary care, mental health, have been working exceptionally hard and working even harder now. Fantastic things with the vaccination programme, but that's people who we haven't got enough of. We didn't have enough of before the pandemic, who are stretching themselves even thinner to make sure they can do fantastic things with the vaccination programme. But people are pretty tired, Eddie.
And is that? I mean, everybody works hard. I'm trying to get a sense of, are people doing extra shifts, longer hours, more overtime, covering gaps where agency staff can't be brought in, that kind of thing?
All of the above, and they've been doing that, since March. And even the vaccination programme, which has been a fantastic morale boost, I think, for colleagues in the NHS, that involved people working nights and weekends to get everything set up. It's involved a massive logistical challenge. There's, the present vaccine is pretty complicated to give. People have put in a huge amount of extra time to get trained and ready to distribute it. So yeah, all of the above. People in all sorts of ways, both clinical roles and non-clinical roles, are consistently going above and beyond. And as Catherine, who you from the Royal College of Emergency Medicine touched on, we as rates of infections go up in the community, our staff contract the virus as well. So we're in some parts of the country we're dealing with increased levels of sickness absence as well. And that impact upon people's teams. But people have been astonishing in terms of the work they've put in this year.
We know that January and February are always the trickiest months for the National Health Service in any year. How do you think it'll be for 2021?
As you rightly said, we get ready for every winter, every January in particular, in terms of how it's going to be. But in most parts of the country now, the rising rates of infection are preparing us for probably the worst. I've worked in the NHS for over 30 years, and I think I'm preparing for the worst that it's ever been in my time.
And what tells you that? What's the canary in the coal mine for you? I mean, we can see the cases rising, but what makes you worried that the NHS will struggle with it? So we know that this time of year drives up illness anyway. Respiratory diseases become more prominent for patients. It's a particularly difficult time for our elder citizens. But we also know from our experience of the pandemic this year that as infections rise, admissions rise, and as admissions rise, the harm and sometimes death that results grows. And the way in which we have to organise our services, whether in hospitals or in other ways, also means there's an impact on other things that we provide for patients, Eddie. We see that disruption to other services, which we don't want to see, but we know that's a consequence. Often in January, we know from this year and our experience now of 2 waves of COVID, that will have a similar impact again. Just finally, the arguments being put forward in favour of this Christmas relaxation, and they're quite compelling, aren't they? People's mental health, the suffering that's been in families across the country this year has been huge and is harder to document than COVID figures. But you also know the fear that there's going to be an even bigger surge in cases. Where are you with this?
I think where we are, and as we talk to leaders, they absolutely see the difficult position all the 4 governments have been in. The key question in England now becomes what happens on the 28th of December. And what NHS leaders want, what the public need, is clarity and certainty about what happens after these Christmas arrangements end. I think it is helpful that the Prime Minister's come out so strongly and said that people need to exercise extreme caution. What's advisable in the Christmas bubble is very, very different from what's permissible. But actually that clarity and certainty on the 28th, that's the thing that we need now.
Thank you for talking to us. Happy Christmas when it comes. Danny Mortimer, Chief Executive of the NHS Confederation.